What is a colposcopy? That word is strange. It sounds kind of like colonoscopy. It's often miswritten as coloscopy, but what actually is a colposcopy? It's a procedure to look at your cervix, and you may have been suggested to have one of these done if you've had an abnormal pap smear. I'm Dr. Monica. I'm a board-certified OBGYN and a mom of 3, and I perform these procedures all the time. So I would like to describe to you in this video what a colposcopy is, what you can expect, and what the details of the procedure are, and why you might be having one done. So a colposcopy is a procedure that's done to look closer at the cells of the cervix. These are recommended to be done when you have had an abnormal pap smear. Now, there are a lot of different pap results that might lead to you being recommended to have one of these done, and we're not going to go into all of that today. But I want to talk to you about the actual procedure of the colposcopy. So as I mentioned, easily confused with colonoscopy, but vastly different. The colposcopy is a procedure that is done in an office setting. You will come into an office similar to any other office visit with your OBGYN or your gynecologic clinician. And the procedure is done in a regular office room or sometimes in a procedure room in the same office, but generally there is no anesthesia or no sedation required for this procedure. So step 1 is always to pre-medicate at home with some type of NSAID. So something that is a non-steroidal anti-inflammatory like Motrin, Aleve, that type of medication if you're able to take it. It's always a good idea to have those on board before any type of GYN procedure. So how does the procedure go? We will start by getting into the usual position, which is on a GYN bed with our legs in the stirrups. This will start off by using a speculum to visualize the cervix, and then in will come the colposcope. So this machine will likely be sitting in the room when you get there, and it can be a bit intimidating because it's large, it's long, there are a lot of moving parts to it, and it might be a little bit scary and intimidating to see at first, but here's the good news. That thing does not touch you at all. It is just a microscope. So that is allowing your clinician to look through the lens of that scope and look onto the cells of your cervix. So once the speculum's in place, you will then likely have some solutions placed on the cervix that help with visualizing the cells. This is usually a vinegar solution, which sometimes will make you feel a little bit of a stinging sensation that generally goes away after a little bit. And sometimes there will be a darker solution used, something called Lugol's, which is a darker stain and allows for different views of the cervix as well. So once those are applied, the scope will come into play and your clinician will go ahead and look through it and examine the cervix. So when we're looking at the cervix, this is what we see. Just kind of looks like a big old donut. And the solutions will have been placed over, with this being what's called the os. So this is the canal that comes from the cervix and goes up into the uterus. And the key area is what's called the transformation zone. So this is the area right around here where the cells change from being the cells that are typical of the vagina and the ones that are typical of up in the uterus. And this is a key zone that needs to be visualized with that scope to look for the problematic cells. Now, sometimes when we look, we will see an area that looks like there may be an abnormality. Sometimes it will be a little bit of a patch that looks white. Sometimes the vessels will look abnormal. There are different characteristics of those cells that are significant when we look through the scope. So if an abnormality of some sort was seen with the microscope, then a biopsy will be performed. Now, this is done by taking a small pinch of tissue from the area that was found to be abnormal. This is perceived differently by many different people. So some people actually won't feel the biopsy at all. Some people will feel a pinch or a cramp, and some people have told me that it's very painful to have that biopsy taken. It depends on everybody's difference in how they perceive pain and may have something to do with the location of the biopsy as well. Now, once the evaluation of the cervix with the microscope is completed, any biopsies have been taken, the next step most of the time will be to obtain something called an ECC. This stands for endocervical curettage. And what this is that canal in the cervix, which we can't really see all the way into with the scope because it goes in and up, we will want to evaluate that by getting a small portion of tissue from that area. So the way this is done is that a small instrument is placed into the canal and a scraping biopsy is taken from the canal of the cervix. So this is generally quite crampy. This is something that almost everybody will associate some cramping with. Some people tolerate it very well, some find it quite severe. But this lasts for about 5 to 10 seconds while we obtain some cells from that cervical canal so that we can send those off to make sure that they don't have any signs of cancer there. Now, once all of that is complete, sometimes the biopsy sites or the site of the ECC will be bleeding. So sometimes we'll place medicine on those areas so it doesn't bleed too much for you. This can be something called a Moncel solution, which looks kind of like a honey mustard or a peanut butter and is quite thick and chunky. Or it can be something called silver nitrate, which is a small stick of a coagulant type of material that's placed on the biopsy, and this is a gray silver look to it. Both of these materials will sometimes turn black. So what you may see afterwards is significant discharge that looks either like spotting, yellow, brown, might be some black, might be some gray. There's a big array of what you might see for discharge afterwards that is generally normal. If you've been finding this information helpful, please drop a like to help other people find this information as well. Now, the procedure is done once we've completed the biopsies, the endocervical curettage, and we have ensured that everything that was bleeding is no longer bleeding. So what can you expect afterwards? It's normal to feel some cramping after from the biopsy sites and from the ECC. This often will resolve over the next hour to a few hours, but sometimes people notice some crampiness through the day. This is best treated with some form of an anti-inflammatory medicine like an Aleve, Motrin, something along those lines. And the other more significant symptom that most people will see is discharge. So as we mentioned from those medicines that are used to keep those biopsy sites from bleeding significantly, those will contribute to some discharge over the next day or so afterwards. It's also normal to see a little bit of spotting because those biopsy sites can start to bleed a little bit once you leave. And then when the cervix heals, it creates a discharge. So pretty much anything that is in the realm of light spotting, a tannish or yellowish discharge, a coffee ground black yellowish discharge to spotting or even some black is all normal. The main things that would be abnormal would be heavy bleeding, green discharge with any type of pus or very foul odor to it. You would likely notice a slightly different odor because there are different chemicals that were placed on the vagina during that time, but it shouldn't be particularly foul smelling. The other question you might have is, why did I go through this procedure and what is the real point of having this done? And the answer is that your pap smear is a screening procedure. It obtains some cells, it can test for HPV if indicated, but it doesn't give you a diagnosis. It just shows if the cells may be abnormal and it gives a suggestion to what degree that abnormality is. A colposcopy is what we call a diagnostic test. So once we've looked through the cervix and identified an area that looks abnormal, obtaining a biopsy of that and taking that tissue to be sent to look at it by a pathologist can give us an actual diagnosis of if there is a dysplasia and what degree of dysplasia there is. A dysplasia is a word for somewhat of a precancer. So it means that the cells don't look normal, but they don't look like cancer. They're somewhere in between in their abnormality. And the colposcopy allows us to get a diagnosis on that dysplasia to say what degree that abnormality exists at. The colposcopy is very important for guiding your treatment going forward when it comes to your cervical health, and it's very important for ruling out or detecting cervical cancer. So that is the rundown on what a colposcopy is. Best of luck to you if you're going to undergo one, and please be sure to always follow up with whatever follow-up is recommended by your doctor. When it comes to screening for and preventing cervical cancer, prevention is key. And when we have abnormalities or do things like colposcopies, there's close and specific follow-up that's recommended afterward to make sure that nothing progresses in the long term to cervical cancer in the future. If you'd like more information about women's health and obstetrics, please check out my channel. Otherwise, thank you for watching and I'll see you next time.